Hi, I'm Dr. Yannis I'm plastic surgeon and director of 111 Harley Street in London. I like to perform a lot of facial surgeries, rhinoplasties, facelifts, buccal fat removal, blepharoplasties, and I like to consult my patients and explain to them exactly the effects that these surgeries can offer to them, so they are fully aware before making their decision. The best candidates for rhinoplasty are patients who have thought about what they want to change about their nose, what kind of end results they're looking for. They have to have realistic expectations, and they have to have a mental stability to undergo the operation and the after the operation recovery period. I like to perform rhinoplasties on fully developed noses, so my minimum age is usually 18. However, there are some exceptions to this rule, especially for noses that are very deformed or where there is a deviation of the septum impeding breathing. Rhinoplasty is an aesthetic operation that is looking to change the shape of the nose. There are some non-surgical procedures that can help us achieve some of these goals. For example, filler injection or threading, or even Botox can have some effect on the shape of the nose. That is a very good question, and as this treatment gains more popularity, I see more and more patients that have been treated with fillers before. My advice would be to bring pictures of the noses before the treatment for me to see, and in most cases I would like to dissolve the filler before embarking on an operation. Here the rule of thumb is 1 year. The recovery from a rhinoplasty is a lengthy one. It's something that I stress to my patients when I see them, and it will take 1 year for full recovery in terms of finalize the shape and what we call skin contraction. For the majority of rhinoplasties that require skeletal changes, general anesthesia is recommended. However, this is a light general anesthetic, and most of these procedures are performed as day cases. However, there are cases like when we do only tip changes or alar-based changes that can be performed under local anesthesia. Rhinoplasty is a very safe operation performed with experience. However, like any surgical operation, carries risks such as bleeding, infection, contour irregularities, or even breathing problems. You should ask your surgeon about these potential effects of rhinoplasty. Different people get different effects from rhinoplasty, and of course different rhinoplasties have a different effect on the face. For the cases where we do osteotomies or cutting the bone, usually bruising can occur under the eyes to various degrees, but after 2 weeks, most of the times that has gone. You may experience some difficulty breathing the first days after your surgery due to the swelling from the operation. Usually these problems subside after 2 weeks, and usually the sensation of smell is not affected by the surgery. Well, the nose will go through stages of healing. After 2 weeks, most of the bruising and swelling will be gone. After 6 weeks, your nose will be completely healed in terms of going back to all your activities, including sports. But final results in terms of detail can take 6 to 12 months to be finalized.